Hi, I'm Ruwaida. I'm a registered nurse and midwife, and I'm at Birth on 5th and Oxford Midwifery, specializing in low-risk births. Today I'll be telling you a bit about labor and birth, but there's a specially designed course that will excite you and answer all your questions in the antenatal and postpartum courses that's offered with your pregnancy. The first thing I'm going to tell you about is birth options. You know, as South Africans, we actually spoiled for choice. So you can see what suits your pocket, what you want, and you go towards whatever favors you. The first choice moms have is a hospital birth. Now, hospitals can depend on private and public facilities. Do you have medical aid and finances for private? Or would you prefer a government setting or public sector, which is obviously free of charge, offered to you by South Africa? In a government setting, you would need to then see a public facility clinic, which is the local clinic that is closest to you. You'd get a clinic card where midwives will assess you throughout the pregnancy. During that, they assess your blood pressure, your weight, your baby growth and development, and you might have 2 scans in that pregnancy. With that, you might also see a specialist twice in the pregnancy according to our South African guidelines. Now, if you're low risk, meaning that there is no complications, you will then birth at the clinic at that first or primary setting. If there's complications or twins or any medical problems that they're concerned about, you deliver at a tertiary clinic, which is called a hospital. Now, there are a lot of hospitals that you can birth at. That's a government setting. Then you get a private setting where you'd see a private obstetrician of your choice, in the center of your choice, in the area of your choice. You then see the obstetrician throughout the pregnancy, and when in labor, contact that specific doctor. He then works or she works at a specific hospital, which is private. You then go in and you're seen by the staff midwives that will assess you, monitor your baby, and call the obstetrician and give them updates. That doctor that you've chosen will then come out and do the normal birth or a cesarean section at that specific facility. Now, that's your second choice. The third choice that you have is many moms want a home birth. So they don't want to travel out, and that's when a midwife comes to your birth setting, which is your home, and does the birth at home, in the comfort of your own home, and if need be, and there is a complication, then transfer out only to the hospital closest to you. Some moms don't want a home birth, and that's what we offer, a home birth setting, like Birth on 5th, where you can come in, birth your baby in a home birth setting, where your midwives are there, probably doula care, and you stay at that unit until you're ready to discharge. Then the third one is the home birth almost setting, which is called an active birth unit or a birthing facility. Those are midwifery-led centers where you'd see your midwife throughout the pregnancy, and when you're in labor, call the midwife. The midwife and you then proceed to the facility, which has a theater on site. So you birth in a unit that looks pretty much like a hotel setting, and if you need theater, it's done on site at that specific active birth unit. So there's it, the choice is yours, and it's all up to you on what you'd like.